Hi, my name is Zach. I'm an admissions coordinator here at Evolutions Treatment Center.
My name's Adam. I'm an admissions coordinator here at Evolutions Treatment Center.
And what do you guys actually do by being an admissions coordinator? You start off with you, Zach.
Sure. So, as admissions coordinator here at Evolutions Treatment Center, what I'll typically do is I will be speaking to either family members or the patients themselves on kind of seeing where they're at, describing our program, the many different levels of treatment that we have, going through certain criterias to see what level of treatment would be applicable for them. I also will go over certain insurance aspects to see if it's something that we can accept here, and if not, trying to find the best placement that I can possible.
Typical question would be how to choose the right treatment. How do I choose the right treatment when somebody asks you that?
So we typically do a patient history and precipitating factors before the admission, which is a little unusual for treatment centers because we really want to get a full picture of where the individual's at so we can find exactly what level of care we want to begin them at. We wouldn't want somebody to be set up for failure by allowing them to continue with the idea of going to outpatient therapy once a week while they still have a physical addiction to a substance. Mm-hmm. So that line of questioning and family history, finding out what narcotics either prescribed or street they're on, see what therapies they've had in their past. We can get a full picture of an individual and find exactly where in our full continuum of care we want to place them. Mm-hmm. And then we can go from there. And in that heavier line of questioning that we start with, really helps the clinical team have a clear picture of the individual before they even come in the door, and that's a big chunk of the process that we have is getting familiar with the individual and what they're going to need while they're with us.
Zach, what type of programs do we have, meaning levels of care and all the different aspects of programs that we have?
Absolutely. So that's definitely a common question that we get. So here at Evolutions, we have all levels of care, and that's a beautiful thing for the patient and us as well. And that way our clinicians and our medical doctors can see you through your full continuum of care. Now, when we say all levels of care, full continuum of care, what that means is that the different levels that we offer are detox, inpatient level of care. And that's typically when someone has a physical dependency to either drugs or alcohol and they need to be medically detoxed. The next level of care after that would be residential. And residential would still be here at our North Miami facility, and here we treat both detox and residential. And at residential is kind of when you're starting to get over that medical detox, but there still might be lingering physical symptoms. And we're starting to now integrate more of a clinical style of care. So you're gonna have more time with your therapist and less time, going through physical withdrawal symptoms. And so that's typically the next level of care. After that, at our Fort Lauderdale facility, we have partial hospitalization, intensive outpatient, and then outpatient level of care. Partial hospitalization is when you are getting minimum 25 hours a week of clinical care. And intensive outpatient is when you're getting 9 hours at least of care. And then outpatient would be when you're usually in sober living, which we also offer here, and you're coming in maybe one time a week and meeting with your therapist and doing some groups. And so, again, when we say all levels of care, we want to be able to transition you from going to something full inpatient to stepping you down gradually. Because in a lot of cases that we see, when someone just comes in and they want to just get their detox over with, get back into their life, there's a very large contrast of going from inpatient to all of a sudden you're back in your life, you're not doing any follow-up care, and we see a lot of success when someone is transitioning in a healthy way. And so that's what we offer here at Evolutions.
And Adam, what type of advice can you give to a family member maybe that, or a friend that's calling in for a family member that is struggling to get their loved one help what kind of advice can you give to help them?
A lot of times, and we get these phone calls often, where it's a mother or a father calling in for their child. And funny enough, we do get friends a lot who are calling in for somebody that they've had in their life for a long time. They know they have active insurance, or they're willing to help out, and they want to figure out the process for them. And it's really difficult when you have somebody that is still maintaining some kind of normalcy in their life, and so they may not think that either inpatient treatment might be right for them because they're managing their symptoms. And I was one of those people. I led a pretty normal life from day to day, even though I had a pretty severe narcotics habit. And best advice is really the family letting the loved one know that the option is there. Because no matter what, when someone is suffering with a disease of addiction or mental health issues, there's a part of us somewhere that knows we can't manage this forever. And a lot of times, loved ones really are just waiting for someone to reach out and say, hey, look, this is here for you. It's an option, not necessarily a force. But letting them know it's an option, and God willing, that'll give them the opportunity to come clean to their loved ones and say they need help. Now, if you've already passed that level, and the person knows that treatment is an option, that they could go anytime they want, the one who's suffering knows that the loved ones have found a facility. We do help with some other options. We have trusted interventionists that we work with that are within the community, that are very seasoned throughout the years, that we can get family members in contact with, and that's when a higher level of care for an individual is needed to push them in the right direction, because other options have failed. And we've also, sadly, sometimes you have to wait for the critical moment of that hospital visit or that call from a jail cell. And we also will pick up the line in those events and walk the family through the process of that transition from hospital to our intensive care, or from the courthouse to us. And we do have liaisons that work with the courts that will help that process. Somebody who's choosing, probation and treatment instead of a jail cell. And of course, me and Zach are always willing, and I ask every time a family member or a friend calls, do they know that you're seeking treatment? Could you give them my phone number? Could you ask them if they could have a phone call? It's not you need to come to us. We just want to answer your questions, because they may not know what their options are.
Adam, when a patient or loved one asks you, what is detox going to be like? How am I going to feel? I know some patients might have some fear of getting off of maybe something like opiates, of the withdrawal is kind of, you're very fearful of how it's going to be. As myself, as I know in recovery, I have without detox. Can you explain what you tell patients or loved ones, what it's like at detox from their substances?
So just like the rest of our program, I really feel our detox portion is typical of the rest. We are not a cookie cutter program. We do not treat people exactly the same from patient to patient. So when an individual comes in, they're fully assessed by medical staff. Signs, symptoms, weight, history of use, and we're going to find a treatment protocol that is going to keep them comfortable, but most importantly, not needing detox after detox. Our medical staff is very good at listening to the patients. You meet with a doctor very shortly after you arrive to figure out what your medication protocol is going to be, so that you stay comfortable. And comfortable is that main word, because I know every time I've gone through detox, the only thing I prayed for was to be comfortable. And our medical staff is highly trained and seasoned. we've seen enough people, we've done enough time, and with the newest research out, very quickly we can find the medication protocol that's going to be appropriate for you on the right kind of substances that you're going to need to come off of appropriately and safely and comfortable.
One question that I can see that could be quite difficult sometimes for loved ones is, will my insurance cover? Well, how much is this going to cost me? You know, so how do you explain that to a family member, a loved one, or a patient when they ask that?
Absolutely. So here at Evolutions, we are in network with a wide range of insurance companies, and that makes it a lot easier to assess whether your insurance is going to cover, how much the deductible is, how much your out-of-pocket max is, as we do have in-network contracted rates. And so that kind of makes it easier for you and for us. Typically what I'll do is I'll ask what insurance they have. I will get the information. Usually it's the member's name, date of birth, the member ID. And what we do is we do a twofold verification here at Evolution. So we'll actually check online to see what information is available, and then we will also call and do a live verification with your insurance company just to verify the information that we are collecting. We do work with out-of-network insurances as well, and we go through the same process with that. If someone needed to privately pay for treatment, then we're going to need to do our precipitating factors in history, assess whether you're going to need detox. That's the first and foremost thing, whether you're going to be placed in partial hospitalization, if you just meet criteria for intensive outpatient with sober living, and all of those are going to have different costs. And what we like to do is we kind of like to work together with the patients and their families to see what's the best thing available. If there needs to be a payment plan put in place, then that's something that we can also do here.